Let us attach the lower limb to the pelvis. Here is the ilium and here is the acetabulum. Then after the acetabulum you have the ischium and the ischiopubic ramus, and you have the obturator foramen here. So this is the head of the femur, the neck of the femur, the greater trochanter and the lesser trochanter. You would find the articular cartilage in this region, and this is the non-articular part of the acetabulum. Similarly, there is an articular cartilage which is all around the head of the femur up to the neck, except the region of the fovea capitis. Here there is no articular cartilage. Articular cartilage. Then you find that at this end you find the labrum acetabulare, which is a part of the cartilage itself. Outside this, you have the capsule which attaches to the intertrochanteric line in front, but leaves the lateral 1/3 of the neck outside posteriorly. This is the part of the capsule here, and this is attached to a ligament which is called as the transverse acetabular ligament. So if you see this acetabulum in a form like this, then this notch structure, the notch part of it, is joined by the transverse acetabular ligament. From this transverse acetabular ligament, you have a space behind, you have a space you have to space here through which enters the branch of an obturator artery. So the obturator artery is here, going like this. It gives a branch which is called as the artery of the ligamentum teres, and it enters through this notch. Then it lies on a ligament which is called as the ligamentum teres, which goes and attaches to the fovea capitis. So this artery goes on the dorsum of this ligament and comes and gets attached to the, enters the head, supplying 3% of the head. The next thing we draw is the synovium. From the acetabular labrum, there is this synovium which is lining the capsule, which is called as the visceral layer. Then it winds round and goes around the neck. So this forms a cavity which is the synovial cavity. Now I'll make this synovium because it's a round sheet which is surrounding the neck. For example, if this is the section of the neck, here is the marrow of it, then the synovium is surrounding it like this. And at two places, anterior and posterior to the neck, the synovium is raised like this, and it encloses a blood vessel. So we'll make these blood vessels now. So here is the femoral artery coming. The femoral artery is giving a profunda femoris. The profunda femoris embraces the base of the upper end of femur by a medial and a lateral circumflex femoral artery. The medial and the lateral circumflex femoral artery brace the base of the neck by anterior and a posterior ascending artery, and this arterial arcade formed at the base of the neck gives a branch which would raise which will raise a sheet like this, in the synovium. It will cross the growth plate and supply the rest of the head. So this vessel here, surrounded by this synovial sheath, is called as a retinacular vessel. And there is a posterior retinacular vessel and anterior retinacular vessel. So this supplies the 97% part of the head. The beauty of this vessel is that it crosses the growth plate. It crosses the growth plate. Here will be the growth plate. So it crosses the growth plate, and therefore this forms the rest of the supply of the head. Now what happens is that in this synovial cavity, if there is fluid, and this is in a closed space of the capsule, so this leads to increased pressure. So effusion leads to pressure, and this pressure causes blockade or pressure on the collapse of the retinacular vessels collapse. So the head becomes ischemic. Since it is a child, the intraosseous vessels are not able to cross the growth plate, and therefore the head becomes shrunken, it becomes fragmented because blood vessels try to pierce it. Blood vessels try to pierce it, so it becomes fragmented. It is surrounded by new bone formation, which is the head in the head sign, and finally this head, which becomes soft, may collapse. So it may collapse from above, so it becomes like this. It is now not directed this way, but it is now directed this way, and therefore this leads to an adduction deformity. And if you see it from front, from top, this is the neck, and this should have been the head, but now since it is collapsed, it becomes directed backwards. So this leads to an external rotation deformity. And this, finally, the pathology is over and the whole head is ossified in a wrong shape. So we say it is flattened from top and anteriorly. From top, the adduction deformity; from anterior side, the external rotation deformity. So this is the pathology of Perthes disease. Now, this capsule, now we are outside the capsule. Here is the transverse acetabular ligament. So this capsule is strengthened by a ligament attached from the anteanphilic spine to the intertrochanteric line, which is called as the Y-shaped ligament of Bigelow. This is the iliofemoral. Then there is a pubofemoral. Pubofemoral ligament. And there is the ischiofemoral ligament, which goes behind and strengthens the posterior part of the ligament. Iliofemoral, pubofemoral, and ischiofemoral ligaments. Now, outside this hip, the muscles that attach the pelvis to the femur are classified into adductors, there are 7 of them. The 3 above are obturator externus, coming from outside the obturator foramen, passing below the neck and getting attached to the trochanteric fossa. So it's parallel to the ischiofemoral ligament, and this is the obturator externus, which is sandwiched between a muscle attached to the lesser trochanter. Here is the lesser trochanter, and here is the muscle that is attached. Here is the pectineus. So it's sandwiched between pectineus in front and quadratus femoris behind. So here is the quadratus femoris arising from the ischial tuberosity. So the first is obturator externus, sandwiched between quadratus femoris behind and pectineus in front. And then the three lower ones are adductor longus, brevis, and magnus. So I told you there are 7. I have just said 6. The 7th one is the gracilis. So these are the adductors. Now we'll make the flexors. This is the iliac crest, the anterospilic spine, the anteanphilic spine, the pectineal eminence, the notch for the artery vein and nerve, the pubic tubercle, the pubic symphysis, the ischiopubic ramus, the ischial tuberosity, and here is the acetabulum. So under the pectineal eminence, you have the head of the femur, the neck of the femur, the trochanter, and the lesser trochanter. Here you have the posterior spine, posterior iliac spine, greater sciatic notch, ischial spine, and here you have the obturator foramen. From here to here, anterospilic spine to the pubic tubercle, you have the inguinal ligament. Now, you already said that the capsule has connected the acetabulum to the intertrochanteric line in front and has covered this hip. So here you have the sacrum, you have the spine, you have the sacrotuberous ligament, which you can see here, and the sacrospinous ligament. So now we'll place the muscles. We said that this gives rise to femoral vein, artery, and nerve. Then you have the pectineus muscle from the pectineal eminence, the pectineus muscle. Then you have the psoas, which arises from the spine, comes under the inguinal ligament, and is attached to the lesser tuberosity. So here is the psoas major. And this psoas is substantiated by the iliacus. Then from the anteanphilic spine, you have the straight head of the rectus femoris, and the iliofemoral ligament. The curved head of the rectus femoris comes from above the acetabulum. So here you have the rectus femoris muscle. And then you have the sartorius from the anterospilic spine. So in front you have the sartorius, the iliopsoas, the pectineus, And from the intertrochanteric line and the intertrochanteric and the spiral line here, which goes into the intertrochanteric subtrochanteric crest and the spiral line lateral, which goes into linea aspera, you have a origin of a huge muscle which is the vastus medialis, vastus intermedius, and vastus lateralis. So rectus femoris coming from top, this is the rectus femoris, and the vasti form the quadriceps. So these are the flexors of the hip. And different from the adductors, which we have said are obturator externus arising from here, pectineus, we have said pectineus, quadratus femoris, and adductor longus brevis magnus. Alright, so these are the flexors of the hip. Now we'll talk about abductors and extensors. So you look at this from behind. Here is the acetabulum. Here's the posterior superior spine. Here's the posterior inferior spine. Here's the greater sciatic notch, the ischial spine, and here you find the ischial tuberosity. Here is the acetabulum. Here you find the head from behind, the neck, the greater trochanter and the lesser trochanter, and you find that the capsule leaves out the outer part of neck, and it is strengthened by the ischiofemoral ligament. Then you find that there is this obturator externus muscle coming from in front, winding round the neck and getting attached to the trochanteric fossa. So this is the muscle that is covers the lateral part of the neck. So this is obturator externus. Then you have the quadratus femoris attached to the quadrate tubercle. Then we'll make the sacrum from behind. We'll make the sacrotuberous ligament. We'll make the sacrospinous ligament. We'll make the piriformis arise from in front of the sacrum, pass like this through the greater sciatic notch and get attached to the trochanteric tip. We will get the obturator internus tendon emerge out of the lesser sciatic foramen and get inserted in the so this is the tendon, get inserted into the intertrochanteric crest. Then you have the superior gemellus and the inferior gemellus, which makes this a triflagellate tendon. So inferior and the superior gemellus, which makes it the triflagellate tendon. And this is the quadratus femoris. Now you have the ischial tuberosity. The ischial tuberosity is divided into a quadrangular portion posterior and a triangular portion anterior. Quadrangular portion is divided by a diagonal line into an upper lateral and a lower medial. From the upper lateral arises the biceps femoris. Long head, and from this lower medial arises the semimembranosus and semitendinosus. The lower triangular portion is divided into an outer and inner half. From the outer half arises the adductor magnus, and this adductor magnus is attached to the linea aspera here. So you can see this adductor magnus like this. So from top to bottom you have the piriformis, you have the superior gemellus, the obturator internus, the inferior gemellus, the quadratus femoris, and the adductor magnus. And all this is covered by the biceps femoris. Biceps femoris arising from here, and the two semimembranosus and semitendinosus from this part. All this is the extensor and external rotator apparatus. And you have the gluteus medius attached like this, and minimus in front going and getting attached to the trochanter. The minimus would flex, the medius would abduct, and the maximus would extend. Now this maximus, we will tell you, arises from this portion of the ilium, arises from the sacrotuberous joint, sacrotuberous ligament, and gets attached to the gluteal tuberosity here, covering all these muscles. So this maximus covers all these muscles. So this is the abductor and extensor apparatus, and we'll make one more, and that is that as you see the iliac crest, there is that iliac tuberosity, the anterosophiliac spine, and the posterior superior and posterior inferior spine, the greater sciatic nerve, the ischial spine and ischial tuberosity like this. And here we have made the head, the neck, the lesser trochanter, the greater trochanter, and we had made these spiral lines convert into linea aspera. And the anterosophiliac spine was somewhere here. We can't really see this portion, but we can see a muscle, which is the tensor fascia lata, which arises from this point, becomes a tendon, band. This is called the iliotibial band, and this gets attached to the linea aspera like this, which forms the lateral intermuscular septum. So, in short, the adductors are obturator externus sandwiched between pectineus and quadratus femoris. The adductor longus brevis and magnus. And gracilis. The flexors lateral to medial are sartorius, iliopsoas, pectineus, then straight head of rectus femoris should also flex. Then the main extensor of the knee we made, which was the quadriceps, formed by rectus femoris, which flexes the hip also, but the vastus medialis, intermedius and lateralis, which would only extend the knee. So these are the muscles that we had made. Then abductors was gluteus medius and tensor fascia lata. The extensors were gluteus maximus, under which you can see the piriformis, then the obturator internus with two gemelli, superior and inferior, which forms the triflagellate tendon. Then quadratus femoris, and you of course end in the ischial head of the adductor. Then another component of the adductors were biceps femoris from the ischial tuberosity, long head, and semimembranosus and semitendinosus, and then the ischial head of adductor magnus and the Alcock's canal. So these are the muscles, how the pelvis attaches to the lower limb, flexing, abducting, adducting and extending the hip, and also internally and externally rotating it on the axis of which passes on three axes, which passes through the center of the head of the femur. The supero-inferior axis, on which there is internal rotation and external rotation. The side-to-side axis, on which there is flexion and extension. And on antero-posterior axis, on which there is adduction and abduction. So this is how the outer part of pelvis attaches to the lower limb.